Welcome to Forum 360. I am Mark Welfel, your host today. Thank you for joining us for our global outlook with a local view. There is a battle going on that is more than 11,000 years old. It began right at about the time of the agricultural revolution, when modern food-producing human populations were stricken with a new host of infectious diseases, like the common cold, the flu, and later hepatitis, COVID-19, and monkeypox, to name a few. Armed with a few vaccines, antibiotics, some over-the-counter medications, and some common sense, medical practitioners have been engaged in this battle to counteract and eradicate these diseases. More than 30 years ago, Dr. Elizabeth Bender joined the fight, and today we will share her story. Dr. Elizabeth Bender is a general surgeon specialist in Akron who operated at the height of the COVID pandemic. Welcome, Doctor.
Thanks, Mark.
Nice to have you here. So take me back to your childhood. How was it that you came to want to become a doctor?
Well, I enjoyed the Sherlock Holmes stories, and Sherlock Holmes was written by Arthur Conan Doyle, who happened to be a medical doctor, and he based Sherlock on his favorite professor, who was Dr. Joseph Bell at the University of Edinburgh. And he gave examples of how Dr. Bell would bring a patient into the amphitheater with all the medical students there and talk to the patient and examine him, and then show the medical students how he could figure out what was wrong with the patient. And then later, my sister, who's 10 years older than I am, became a medical doctor and specialized in infectious diseases. So she is the medical detective in the family. And as a general surgeon, approximately 20% of my cases involve draining abscesses or helping to treat the source of an infectious disease.
What by definition is an infectious disease?
It's an illness that's produced by an organism entering the body, whether that be a bacterium, a virus, a fungus, or a parasite.
Okay. And how do you detect the viruses that are in the body, the infectious germs, if you will?
So many of us have had the common cold, and that's caused by a virus. History and physical, so asking the patient questions, examining the patient. Serologic tests, so testing the sputum, the blood, urine for urinary tract infection, other fluids, looking for antibodies and signs of organisms in the body fluids like the blood, for example, help us identify the organisms. And if there is a collection of the organisms in an abscess or pus, we can send that for culture. So microbiology in the laboratory portion of the hospital really helps us determine exactly what organism is causing the problem.
Have you ever had a blood test come back and you found an organism that you'd never seen before and said, "What is this?" And what do you do at that point in time?
I have had patients who've had unusual infections, not necessarily rare, but something like actinomyces, which is found in the soil. And I had a patient who did a lot of gardening, and she had an infection on her hand, and when I drained it and sent the culture, that was the organism. So I did enlist the help of one of my infectious disease colleagues to guide the antibiotic therapy. Some patients need longer than the standard 7 to 10 days, and they need to be followed to make sure that the organism's eradicated. Actinomyces is one of those that tends to come back if it isn't treated effectively.
You had mentioned that your sister is also a medical doctor, an infectious disease specialist. you took the route to become a surgeon. What guided you down that path to be a surgeon, say, versus an infectious disease specialist?
That's a good question. Medical students are exposed to all the subspecialties in medical school, and even though my sister's an infectious disease specialist, and I highly respect her field and what she does, I tend to work more with my hands. I'm a wood carver and have been since I was 7 years old, so it's about a 50-year hobby. I like to try to help solve a problem, either by identifying it or if a surgery is necessary. Surgeons tend to like immediate gratification, whether it's taking out a gallbladder that's going to help the patient, or removing an appendix, or draining an abscess, something that can immediately help a problem. Sometimes with the medical subspecialties, they have to do quite a bit of testing, collate that material, find a differential, and it isn't always necessarily obvious and not necessarily able to be cured.
Take us back a couple of years ago to the pandemic, the COVID-19. What was your life like before the pandemic, and then take us into the storm of the pandemic, and then kind of your life as you came out of it? What was it like?
So I had my usual surgical routine, which involved, getting up at 5 in the morning, going to my office, which was adjacent to the hospital, and I operated Monday, Wednesdays, and Fridays, and Tuesdays and Thursdays saw patients, and had a great crew at Summa Health System in the operating room, my own quote-unquote block time that was set aside for me, especially on Mondays and Fridays, but Wednesdays as well, including robotic surgery, which is the latest and I think some of the future of medicine and surgery. But then the pandemic arose, and it quickly became clear that unfortunately a fairly high percentage of our local population was going to be affected by this. We had to take measures in order to help prevent the spread of this as much as we could. And the operating room changed completely. We went to emergency cases only. And the COVID patients, we found out quickly, who had COVID but who also may have general surgical problems, we quickly determined that if we could avoid a surgery, say for example, a gallbladder, by putting a temporary tube in the gallbladder to decompress it, rather than operating on that patient and putting them in a more dangerous situation. They already have a life-threatening problem in the form of COVID. Adding more stress in the form of a surgery would have compounded the situation. So there was that part of the problem. The other thing was we quickly realized that we had a supply chain problem. We didn't have enough sterile gloves. We didn't have enough sterile masks. And we had to move to reusable gowns that we had to be careful how we took them off, put them in a special basket so that it could be sterilized and prepared to be reused again. The ICU beds were taken over by COVID patients who required mechanical ventilation. The nurses were understaffed and overworked, and they generally had 1 or 2 patients only, and they had specific gowns that they could use for one patient but not another. And you had to be so careful, as I said, preparing to go into the room while you were examining the patient and leaving the room. And all of that really put a stress on the entire hospital system.
Mm-hmm. When you came out of COVID, and I know we're not officially out yet, but cases are down compared to the high point of infections, and you look back, what would you suggest the medical professionals do differently looking back if we had to go through another COVID again?
That's an excellent question. And I think the medical community has known for a long time that we would have to face an epidemic. We tend to have long memories. I know the general public may not, but we remembered studying about the Great Spanish Flu of 100 years ago, which took approximately 1 out of every 5 to 6 people across the world. And then even further back to the bubonic plague that took 1 out of 3 people in Europe at that time. So we weren't arrogant enough to think that our generation would escape an epidemic. Looking back on the COVID pandemic, one has to realize that that was a brand new virus, so we didn't know anything about it. I think that was hard for the public to accept. But essentially, the infectious disease specialists in this country collated information literally on a weekly basis, trying to determine what we could do to treat this, help avoid spread from person to person, and we're thinking about not only our country, but the entire world.
What makes infectious diseases so difficult to control or even predict?
So there are so many different kinds of viruses, different kinds of bacteria. We have examples of the past. We have smallpox that has been eradicated. It exists only in certain laboratories around the world. As far as the future, we have the recent past to look at. For example, Ebola, which primarily is endemic in Africa, but did touch the Akron area, so that there were some people who came to the United States from Africa, brought Ebola with them. One of them was treated in Texas. The nurse that was taking care of him was from Akron and was told to shelter in place for a few weeks to make sure that she didn't have the problem, but she didn't. She came home to Akron and exposed a fair number of people, and our hospital set aside an entire floor to quarantine those patients and to look for the virus, which fortunately did not rear its ugly head here.
If you're just joining us, welcome. I am visiting with Dr. Elizabeth Bender, who's a general surgeon specialist here in Akron. And we're talking a little bit about COVID. And I want to switch gears now to your sister. You and your sister are both medical doctors. And growing up, did you both know you were going to be doctors? Did you talk about it? And even now, do you consult on patients, or if you're even permitted to do that? What's a working relationship like between two sister doctors?
So she is 10 years older and 10 years wiser, and just the loveliest person you ever want to meet. She's won many teaching awards at her facility. And as far as working together, unfortunately, we were never able to do that. She's in Cleveland, I'm here in Akron. We didn't talk about it growing up, but she was the pioneer in our family. She was the one who went to medical school first and specialized and had a stellar career long before I went to medical school. But to answer your question, even with the HIPAA legislation, which prevents a physician from revealing anyone's personal information, you can talk about generalizations or how the patient presents and what was done for treatment and discuss the cases. In fact, that's very helpful. It's helpful in teaching situations. So I have asked for her advice on different occasions when I have seen patients that have an interesting problem that I think she might help me figure out, and she has done that. You know, have you thought of this? Look for that. We have, unfortunately, quite a few people in the area who have drug addiction, and they inject drugs into their arms and other places in their body, and that leads to infection, which brings me in to drain abscesses. But the other part of that is that she always wanted me to remember that it's blood-borne and it could affect the heart, something called endocarditis, and to look for signs for that. when a patient develops endocarditis or an infection of the heart lining, it can lead to dangerous valve problems. Again, that might need surgery, not by me, I'm a general surgeon, but by a thoracic surgeon. So there's so many different things to look for with infectious diseases.
Yeah. It's good to have as many minds as you can at your disposal. Yeah. Share with me a success story. Pick a patient, describe some symptoms, and then how you treated it and why it gave you maybe an extra measure of satisfaction.
So I was asked to see a patient who was a healthy, approximately 60-year-old male who within the past few months had begun feeling fatigued and weak. He wasn't able to do the exercises he had normally done. And everything was based upon an initial history that was done that said that he had been at his cabin in southern Ohio. So people were thinking Lyme's disease and or some kind of muscle problem. So I was asked to see the patient about a muscle biopsy, which I did. But the other thing that I did, it's so important, is to get a more accurate history from the patient. So when I asked him about his cabin, it wasn't actually a cabin, it was a 2-story house. He didn't go hiking, he wasn't in the woods, which made Lyme's disease much less likely. He hadn't even gone on the golf course, anything where he would have been exposed to ticks, which carry the organism that leads to Lyme's disease. And in fact, it turned out from the muscle biopsy that he had something called a vasculitis, which is an immune problem, an autoimmune problem. And that was causing his weakness, his muscle problem. We transferred him to the Cleveland Clinic, which has a vasculitis clinic. We're so fortunate to have the Cleveland Clinic, University Hospital, just 30 miles down the road. Mm-hmm. And he was diagnosed with a very rare eosinophilic granulomatosis. And the physician at the clinic said he had only seen one case before. Mm-hmm. He was placed on the treatment for that, which involved steroids. And when I saw him 2 weeks later in the office, he was feeling back to baseline.
Oh, that's great.
Which is amazing.
Yeah. Congratulations. I want to look ahead. I'd like you to peer into your crystal ball and tell me about the world of medicine 10 years from now, integrating maybe what we've learned from COVID and those changes that are perhaps kind of permanent in our society and in the world of medicine. What's the world going to look like in 10 years for a medical doctor and for patients?
As far as medicine is concerned, the physician-patient relationship will still be central. Hopefully, most of that will be in person, but some of it will be telemedicine, especially for some post-operative patients who live more than an hour away. With telemedicine, they can show you the incision that it's healing well, and especially if they're finding it difficult to get back to the hospital setting. As far as infectious diseases are concerned, I'm afraid we will face more epidemic/possible pandemic situations. We do have a host of medications, antibiotics, for example, but organisms are amazing. They develop what's called resistance to antibiotics, so that's why sometimes patients don't understand when they call for an antibiotic for example, cold or muscle type symptoms, sore throat, and they want an antibiotic. Their physician's reluctant to prescribe an antibiotic unless they see them improve that it's something that needs to be treated. Most viruses resolve without antivirals, without antibiotics. Using antibiotics inappropriately leads to more resistance.
Interesting. So for people who are watching and listening, can you give some advice or some thoughts on the road ahead for them? Some thoughts on how they can better safeguard their health, or what to watch for, or just how to be healthier. I think we're all so-called tired psychologically, perhaps physically. Give us some advice on What
Well,
what life should be like for us? Yeah.
the simple things include washing your hands often. If you're feeling ill, not to go into work or school, to call your physician for an appointment. To continue to safe distance right now. COVID is not completely gone, unfortunately, and we're also under-vaccinated as a nation. So there will be people, especially as it gets colder and we're inside and exposed to people and a little closer to people, just to remember that COVID is not completely gone. Better care as far as watching your diet, trying to avoid obesity, trying to get enough exercise. Those simple things can help with infectious diseases and with your health in general. And as far as the vaccinations are concerned, I know that unfortunately there's a lot of misinformation out there, but vaccination science is based on over 100 years worth of information, and the vaccines are tested before being given to patients. And can you have a reaction? Can some people be allergic to vaccinations? Yes, things can happen. But the other side of that is that if we do nothing, the epidemic in question will kill and harm a great many people.
You mentioned earlier in the interview about robotics and robotics' ability to perform surgery. Where does or do doctors and surgeons come down on this position of robotics? Like, where would their role begin in a robotic machine, or end in a robotic machine begin? Or what's the medical profession feeling about robotics?
So that's an interesting question, and I am old enough that when I started my training, most of the operations were done through fairly large open incisions. And I lived through the transition to laparoscopy, which transitioned to smaller incisions. Robotics goes one step further, where the incisions are still small, but you're able to get the hands of the robot inside the patient, and really they're an extension of your hands. And an easy way to analogize it is to think about the video games that you play, the sporting games where you have some kind of connection on your hand. You're kicking the soccer ball, or you're actually playing baseball or some other sport on a video game. I'm sitting at a console and I'm able to control the arms within a patient and do the same operation with smaller incisions. The advance over laparoscopy, which is a very advanced form of technology in itself, is that you're given your wrist back. So with laparoscopy, the instruments are just a little bit more difficult to use than the robotic instruments, which give you your wrist back. And that's an advantage. We're transitioning towards robotics. I think initially, as early in my career, there was resistance to laparoscopy. There is some resistance to robotics, but every move that we make in medicine is based on data. So research projects are performed where you compare open versus laparoscopic versus robotics. And so far the information is showing that robotics just as good, if not better, in certain situations. In the minute or so that we have left, I'd just like to know, when you go home and you exhale after a long day's work, like, what do you do to relax, to recharge, and get ready for the next day or the next week? Yeah, that's a good question. So I do like to jog. I just finished my 18th marathon, and they've been few and far between because of medical school and training and the practice of surgery. But exercise helps me unwind, and wood carving. I still carve, and I've never taken any classes, so it's not at the artistic level where I would sell anything, but it's a fun hobby, and I make things for family and friends.
I'm sure Dr. Conan Doyle is very proud of you on a lot of fronts. So when in the last 30 seconds or so, I'd like to ask you a couple of questions about your favorite ice cream. Where do you go for your favorite ice cream?
That's a great question. Yeah, I like the Handel's outlets. There's one in Cuyahoga Falls that I go to quite frequently. They have so many different flavors.
Mm-hmm. Favorite hamburger?
Swenson's. Swenson's Galley Boy.
Sounds good. Well, very good. It's been nice having you on the show. Thank you.
Thanks, Mark.
Infectious diseases are the third leading cause of death in the United States, responsible for over 170,000 deaths annually. Our battle against infectious diseases is far from over, and I would like to thank Dr. Bender for your years of commitment and for being on our show today. And most of all, thanks to you and all of you listening and watching. Let's keep our minds and ears open until next time on Forum 360.
Forum 360 is brought to you by John S. and James L. Knight Foundation, the Akron Community Foundation, Hudson Community Television, the Rubber City Radio Group, Shaw Jewish Community Center of Akron, Blue Green, Electric Impulse Communications, and Forum 360 supporters.